ACP is advanced care planning. It's helping individuals to look at what they're going to be doing for their health status from 18 all the way to the point of the grave, end of life. And the idea with ACP is that you should be involved and engaged with doing the planning, having your wishes, your desires, your values recognized in what your health care would be.
What makes life meaningful to you? What are the types of things that you're trying to achieve? What are the goals of care, if you will? And are there any cultural or religious things that would impact your decision making? And so those three things, and it's a series of conversations that happen throughout the course of your journey in healthcare.
What does a good day look like to you? What do you do during that time period? What would happen if you couldn't do that anymore? These are all types of things to think about, and then start having meaningful conversations with people who are important to you, who need to know the information if there's ever a time that you can't speak for yourself.
Well, advanced care planning takes into account the fact that each individual and families, groups, etc., need to have say. They need to have some control. They need to have some self-management in healthcare. Healthcare is extremely complex. It's extremely costly, and it's extremely costly in terms of life value. So if you don't share with people what your wishes and desires are, they won't be known. You won't be living the kind of life that you want. You won't have the quality of life, the wellness of life that you want. And anywhere that you can have self-control or any control is good.
For the patient to have a sense of well-being and to have peace of mind. Medical decisions are often confusing, and it's usually done at a time where there's a lot of fear or anxiety. And so having an advanced care planning consult or talking with people who are going to be involved in your care in advance really helps you to have a peace of mind to know that I have made my wishes known, and people who are going to care for me know what is important to me.
The end-of-life related decisions that occur especially when a patient reaches an advanced stage of their illness, like in advanced metastatic cancers or end-stage congestive heart failure or chronic obstructive pulmonary disease. Advanced care planning can actually help reduce admissions, readmissions, and ICU stays. If this can be achieved in a manner that is patient-centric and that truly acknowledges and is suitable to the patient's own needs and desires for their care, then why would we not pursue such a program?
Now really should have been 10 years ago, but now because it's just really necessary. We want people to feel like that they have a choice, that no one can take that choice away as their diseases may progress. You want your choices to be known now so that later they're honored.
Some people ask me, well, isn't this for old people? And we say, you know what? It's always too early until it's too late. You need to take care of this now while you are in the driver's seat. You get to make the decision. There would be nothing worse than somebody who meant well to do this and then didn't have the opportunity, and the family and the people close to them are left second guessing, did I do the right thing?
With the changes in healthcare, with the growing awareness in the communities about the need to talk about what you want and don't want in your health care, we are really at that point where it's time now to help people have those conversations.